Hi, this is Natural Health for All Ages. I'm Dr. Jean Wagner, Doctor of Naturopathic Medicine, which is a branch of medicine looking to use natural means to improve people's health. Today I have two guest speakers, Dr. Frances Sterling and Linda Elchin, and they opened up a company in West Bloomfield called Adelpha Breast Thermography. And today we're talking a little bit about their company, so I'm just going to have you introduce yourself, tell a little bit, like most people I would say have heard nothing about thermography, or maybe they've heard a little bit on the internet, but tell us a little bit about what it is and a little bit about what you do.
Well, I'm Fran, and early 1980s I developed a healing crisis, and it led me to go to a chiropractor. And within 2 weeks, after I'd been suffering for close to a year, within 2 weeks I never felt better. And that led me to chiropractic school. Of course, I had learned a lot about radiology at that point, and radiosensitive tissues, such as the eyes and the thyroid, and particularly the breast tissue. So that led me to look for an alternative for taking care of myself. Mm-hmm. And I learned about thermography and the differences between thermography and other forms of testing. And that was the prelude to how I got into doing this with Linda.
Okay, so obviously the closest related diagnostic tool that people use is mammography. Okay, so this is a little bit more sensitive in early stages of abnormalities than mammography?
Yeah.
Well, we would say a lot more sensitive than mammography.
Okay.
Detects early changes in breast tissue actually 5 to 8 years before mammography will pick up a lump or a tumor.
Okay. Now, how did you get into thermography?
I'm Linda, and I'm an RN, and I worked in intensive care for about 30 years, and I became a little bit disenchanted with medical medicine, and I started to look at different alternatives, and I went into alternative healing about 15 years ago with massage school and things like that. And at that point I started doing my own thermography, my own thermograms every year, and I think I've had one mammogram in my whole life. So we've been going to a thermogram in Birmingham, doing our thermograms for the last 12 or 15 years, both of us. And the people who own that approached us about starting a mobile unit. They wanted to expand the thermography business out to other parts of Michigan. And so I talked with Fran, and we are both very passionate about thermography and breast health, and we were looking for something to do together, and we said, okay, this is it. This is what we've been looking for. So here we are.
And,
okay.
And it was perfect timing, because the reason why we were so aligned with this company in Birmingham, who's been doing this for over 40 years, is because when we spoke to our friends about it, the majority of them who take care of themselves, they're very healthy, they take care of themselves, they use a lot of alternative methods, such as you're familiar with, and yet none of them had heard of thermography. Mm-hmm. And we knew that we were so much aligned with this group. Mm-hmm. to get the word out and
right.
to educate women.
Right,
and
because a lot of people don't realize, with a mammogram, if you have some type of lesion in your breast, that's a lot of pressure that it's putting on, and you can damage some of the blood vessels, maybe release some of the damaged cells into the bloodstream. They can go around to the body,
Exactly.
etc. And you also had brought in a little study here about, which everybody knows, breast density can definitely affect your mammogram, sometimes making it, so that they cannot read it very well. Mm-hmm. But I also wanted to show a little bit, you have a little chart here, and tell me a little bit about this chart.
Well, this chart shows you the different sizes of cells as they grow in the body, and the small one here shows when cells start to divide, when a cancer cell starts to divide, and we'll look at another chart to show you the numbers, but when they start to divide, when they get this big, area of inflammation or area of that's not doing so well in the breast thermography will pick it up at that size.
And there's no way you're going to feel this
No,
just by palpating,
no.
like doing your own breast exam.
Exactly.
It's too small.
And in fact, self-examination is more on that size before people will
Right,
pick
you would
up.
think you would feel.
You would think you'd feel it.
You'd feel before that, but
A physician will pick it up much quicker at this size. Mammography picks up at about 3 times the size. But
so you said mammography will pick it up about the size of a dime,
about the size of a
Yeah.
dime.
but thermography will actually pick it up abnormalities before then,
Yeah.
which might not show up for another couple years.
And this is, in truth, what the numbers really look like when you're talking about that. That a thermography can pick something up at as small as 256 cells, and many times even before that. And that would happen between year 1 and year 2 of an abnormality being created. Where mammography, it's not until the cells continue to double for up to 8 years, and it's 4 billion cells, will mammography be able to pick it up. So what we're talking about here is the difference
Years.
between, not only years, but also the difference between finding something when it's already developed into a structural problem, but before it's a functional problem or a physiological problem.
Because you're not really diagnosing, you're not saying you have cancer.
Right.
If you find an abnormality, then what do you do with it?
Well, the only thing that can diagnose cancer is a biopsy.
Right.
And, that will follow a mammography, but again, you have to have a lump or bump for mammography to pick it up.
And
And
that's,
so with thermography, you wouldn't have, if it picked it up in the early stages, you wouldn't have anything big enough to even biopsy at that point. But you would have the opportunity to do many different things like nutrition, exercise, lymph massage. There's so many different
turn
things
it
you can
around
do
before
to
it's
turn it around before it
gross.
becomes a structural change.
but you mentioned biopsy, and what we're looking for with any testing is risk factors. We want to see the risk factors, just like we all talk about genetics. But what we know now is thermography is 10 times more significant than family history in determining risk factor. And there was a study of 2,500 women over the course of 10 years who were screened with mammography. And of that, one life is saved. So that's great news. Anytime we can save a life is important.
Right.
But out of those 2,500, 1,000 women are actually have at least one what's called false positive finding, which means they then are either under a lot of anxiety and then get a second mammogram to confirm, or they would then go ahead and do biopsies. And generally, 500 out of that 2,500 women would have an invasive biopsy done, and it would be completely unwarranted. And 5 to 15 women will develop cancer, or rather will have surgery, chemo, radiation to prevent cancer, or because they suspect cancer and it doesn't exist. So out of 2,500 women, there's one woman's life is saved, and over 1,500 women go through some type of trials and tribulations because of the testing. So,
Right.
Where we're at is the system is effective. It's important to have structural testing, but we're being failed somewhere in terms of early detection, or being misled by thinking there's early detection.
And plus with the thermography, if you can find a lesion when it's really small, you said you can change your diet, you can do some things to increase your health, and then you can recheck it.
Right, exactly. You can do a follow-up in 3 to 6 months.
Because this is not painful
Yeah.
at all. It's not like you're going to have, any pain experienced in it. I assume the camera doesn't even touch you. You're just looking at it from a different distance like that.
Yes.
Here's actually a actual thermography scan.
Now, in
Of a
this
person?
in this particular case, we do use the premier interpretation service in the world. They've been doing it again for 40 years. It's
that one's
over a
in
million.
Birmingham?
Yes,
You
over
said
a
in
million
Michigan.
studies.
So
correct.
here we have the premier,
right here, right here.
Premier Interpreting Center right here in Michigan.
And the difference is that they basically do in a way a pre and post in the first thermogram. So you'll notice there are 6 pictures. The top 3 are side views and a frontal view. Then we place our hands in cool water for a minute, and we do another set of pictures. So we have a pre and post where we challenge the body with the cold water, and not only can we pick up temperature differentiation, precancerous or early changes in blood vessels or chemical activity, which will emit certain heat patterns, but then once we put the hands in cold water, we normally have a different reaction with blood vessels that are grown to feed cancer cells rather than the blood vessels that develop when we're in utero.
Right, because cancer has like more blood vessels. It has a higher metabolic rate than normal tissue because it's growing so rapidly, and it's it's really using up a lot of resources.
Yeah.
So you can kind of pick
Well,
those
and that's
things
why
up.
it emits more heat.
Right.
So we pick that up.
Which is why you can use the thermography.
Right.
And then it also has, in the blood vessels themselves, there's no muscle lining. It's like a cheap form of blood vessels that are created
really?
to bring that nutrients to the cancer
So
site.
they don't respond because
So they
have
don't
no muscles.
respond. And this is we're the only mobile unit in Michigan, and the company we work with, Thermoscan, is the only thermography group who do this cold challenge.
Okay, so this is your setup basically. You have your camera, you have the computer, so you actually can go into people's houses. You have like a mobile service. Do people usually do this singly, or do they have a group do it at once, or how does that work out?
Well, we have the capability of going into different doctors' offices around Michigan, and we're also doing some in Ohio. And so we can go into these different offices, because before people had to drive to Birmingham to get a thermoscan. Some people did, they drove 2 or 3 hours to Birmingham to get their thermoscans. So we can go into doctors' offices now, and they can book patients there on given days. We usually go in a given doctor's office 1 day a month and do the thermography there. We also have what we call booze and buddy parties, where women can have a party at their home, like they would a Tupperware party, and bringing about either their closest friends, and we do thermography at their homes during an evening or on a weekend. Now they don't all have to take their clothes off and sit in a group. We do them in a private room, a private room setting. But we also are doing the booze and buddy parties, which are pretty popular, and people are really looking at that option too.
Right.
And we find that some women like to do it in the privacy of their home, but generally what happens is that very few of their physicians are familiar with thermography,
Right.
because most of the studies that have come out in comparing the different types of technologies available today are pretty much obsolete, and that's what insurance companies use for their documentation and policies, that sort of thing. So a lot of women, since their physicians are unfamiliar with it, they'll do their bosom buddy parties, they'll have their thermograms done, and then introduce it to their physicians. And that's how we get invited into offices all over the state.
Because
again,
the report goes to their doctor.
the report goes to the doctor, and that's because only medical doctors can follow up with any structural tests that we may need
Right.
to determine the different risk factors and whether follow-up is necessary. So it's obviously we want to be responsible around taking care of ourselves.
Right.
And so this multimodality way of approaching, including the earliest possible detection, safe for what you had mentioned, no compression. I mean, there's no pain, there's no radiation, there's no compression. It's completely non-invasive.
Right.
So non-invasive, we should show them what it looks like to take a look at my
Yeah, if you want to
face.
show actually how you do it, we're actually not going to do like a regular thermoscan,
Yeah.
but
We'll show you how it shows
you can,
up.
because it picks up heat, you can
Right.
actually look at any part of the body
Any part
that
of the body,
emits heat.
Exactly. So women do choose to do that, and then we have branched out from there to the physicians' offices and yoga studios, massage studios, spas. It can
How
be
far
done
do you drive?
anywhere. It depends on how many nights we want to stay on the road.
Anywhere in Michigan, and we're looking at Ohio as well.
Oh, really?
Northern
Even
Ohio.
the Upper Peninsula?
Well, we haven't had anybody approach us there yet. It'll
Okay.
probably be a weekend trip.
Right, right.
You know, your viewers can do a search online because there are physicians that have the equipment as well and that use the same interpretation service. So that's what you want to look for.
Okay.
And all that information is on our website. So
Okay.
should we take a look at the...
Use
Yeah,
the
so
camera?
This is a camera, and it's a state-of-the-art camera. It's the very best that there is out there right now. And Thermoscan Birmingham also uses the same camera. They purchased it for us, so they ordered it for us so that we have the exact same one that they have and the same software. So we have the camera. We're going to use Fran's face, and this is about how far away from the camera the woman stands.
Okay.
And we focus the camera on, they stand with their hands behind their head like this, and we focus the camera on their breasts, but we're going to do her face, and then this is shows you a picture of her face as it shows up on our computer. And so you can see how the different colors show up on her face, the oranges and the yellows, and that shows different heat coming from different areas of her face. And it's the same thing with the breast tissue. It's very sensitive to heat. Any abnormalities or any tissue that's not doing exactly what it's supposed to be doing will show up a different temperature gradient. And the temperature gradients are very, very tiny. They measure very tiny temperature gradients. So it's very, very sensitive and very effective at taking these pictures.
So it would just take that long, like couple
We take a
seconds, or-
series of 6 pictures. So it actually takes to actually do the actual thermoscan takes 2.5 minutes.
Okay.
Yeah.
And then you do like bowls of water with their hands in the water?
No, that
or-
includes the
Oh, that includes
water
that.
too. We do 3 pictures, which take 10 seconds each, and then we do the hands in the water for 1 minute, and then we do 3 more pictures. So the whole thing takes about 2.5 minutes.
So it's actually not very long at all.
Well,
No.
From beginning to end, it's about 30 minutes because we do a brief case history. Paperwork is mailed or emailed beforehand. And we do a brief case history. There is exposing from the waist up. You want to acclimate to the temperature in the room. And then
For 10 minutes.
Yeah, and then we do the scans.
And
So
Okay.
the scan. Mhm.
it's completely done within 30 minutes.
Okay, great.
And it's important to note that then these pictures that we take, because we're the technicians, these pictures that we take then go directly to Thermoscan, where Dr. Hoekster and his team read those. They go through their software program that's very sophisticated, and then he looks at every single scan that leaves his office. The report comes back to us, and we download and copy it and send it out to the client and the physician.
Now, since it's not very common, I mean, insurance probably does not cover this.
Correct.
Does any type of supplementary, like a health savings account,
Yes, absolutely.
that covers it?
Absolutely.
Health savings, it's tax deductible. It's accepted by everyone other than the current policies of insurance
Right.
companies
Right, right,
for various political and financial reasons,
Well.
which is another show.
right. And it's hard to, change things, get things approved and going in that direction.
Well, and basically what we were saying before is that some of the information was based on obsolete studies. And so the insurance companies are still able to use those.
Right.
So way back in the 70s, studies were done with untrained technicians. You had radiologists reading reports that had not learned thermography and how to interpret that, and the environment wasn't controlled. So if you're dealing with detecting heat, and for instance you have a studio light on, or you have the backlights and you're next to the backlighting, or even a lamp which
gonna
is
affect
emitting
the heat.
heat, it's going to affect your thermogram. So we've come a long way, as they say.
Right.
And so what's called the sensitivity and specificity that thermography has versus other testing has come a long way.
Right, we have this little chart here comparing thermography with mammography. So the sensitivity is like 87 to 97% for the thermography, 76 to 85% for mammography. And combined, this is using both tests?
Both tests.
Some people get both tests.
Absolutely, 98% effective. And the latest findings are that, and recommendations, is that mammograms are to be cautious with them before you're 50, and after 50, every other year. So doing your thermograms when, at the time, premenopausal, when conservatively 15% of cancers are discovered, those can be done yearly.
Right.
And then some women do decide to do mammograms every other year and thermograms every other year as a follow-up.
Okay. Because even if your mammogram is clear, you say, well, maybe I have a lesion that's too small for the mammogram, but the thermography might pick up.
Absolutely.
And sometimes it misses it. 1 in 5 cancers are missed with mammography. So thermography can often pick up something mammography may miss as well. And, of course, vice versa.
And nothing's 100%.
Exactly.
But you can have this done every year, and it's not invasive. It's not giving you any radiation. So you're bound to pick it up.
And it's important to note, too, that thermography can be used with any kind of breast, dense breast, small breast, big breast, implants, surgeries that have been done on breasts, mastectomies even. So there isn't any breast that can't have a thermogram done and be able to look at it, where mammography is very restrictive for cystic breasts and dense breasts. Some small breasts it's hard, really large breasts it's hard to pick up, implants, things like that. So you can use thermography on any breast there is.
All right. Now, what is the specificity here?
Well, sensitivity is whether there's a presence of a disease. A specificity is there an absence of a disease? So if you have a test and they say you're clear, then with mammography, it's only on average 17% that's accurate. But with thermography, even with those obsolete studies, it was 44% effective.
Okay.
Much of the documentation today will say it's 75% effective, and that's when you include other thermology services that may use just imaging cameras, or they may not have consistent readers. They'll have different doctors, different parts of the country. The same doctor may not read your scan each time. So they're only 75% effective, for instance. But with the interpretation service we use, Thermoscan, they have 91% accuracy rate on whether there's an absence of disease. Okay. So we've got sensitivity, whether it's there, or specificity, whether it's not there. It's high either way. It's actually in the 90s with the laboratory and interpretation that we use.
Okay.
And they use an analytical process for discovering this, as Linda was describing, with how it goes through software, then it has scientifically trained readers, and then the Dr. Phil Hoekstra reviews them as well before they are able to leave and be sent out. And so that analytical process looks not only for the different colors that you saw there. Every woman could have a different color spectrum or signature, but we're looking for the pattern of heat. We're also looking for the very specific numbers like she described, and the patterns over time, and any possible monitoring can be done very safely with thermography. Okay.
Now, if a person is interested in getting a thermoscan or a thermography, then they can, search through your websites for locations. Like, maybe I don't want one in my home, but maybe I want to find, do you have locations that you usually frequent? You can say, well, we'll contact this office.
We have doctors that have equipment. And then, of course, we have our mobile unit. So what we recommend is going to our website, which is Adelpha Therm, and that's Adelpha it stands for Beloved Sisters.
Oh, okay.
ADELPHA. So adelphatherm.com. And our phone numbers are listed there, as well as the interpretation service, Thermoscan. And you can check and give us a call, and we'll be happy to tell you the closest location.
Now, what is the price comparative to a mammogram?
Well, mammograms, some people have insurance coverage and others don't. Really what we're comparing is what's the value of 5 to 8 years earlier finding breast changes.
That's huge.
So that's
benefit.
huge. It's only $150. Most women are really surprised when they compare it to what their co-insurance or those who don't have insurance, what
Right.
mammography can cost hundreds of dollars.
Right. Right. It's not that much for, especially if you have a big family history.
Absolutely,
Right.
absolutely.
Well, so it's a really good technology to really help women's health. If you're interested, please contact them or search the internet for some more information. So we're gonna wrap up today, but if anybody's interested, you can contact them from the information on the credits. And this was Natural Health for All Ages, and look for future episodes. Thank you.